Hi, I'm Kenneth. I learned something new this week.
This week, I learned about the types of burns, the different depths of burns, how to administer first aid, and what to avoid, and I am sharing it with you.
Hey everyone, and welcome to This Explainer. Today, we're diving into a topic that is just incredibly practical and honestly something we all need to know about: burn safety. We're going to break down the actual science of what happens to your skin during a burn. And more importantly, we'll go over the exact step-by-step first aid you need when every single second counts. To really wrap our heads around the scale of this issue, let's start with a pretty staggering number: 486,000. That is the number of people who seek medical treatment for burns every single year in the US alone. It's a hugely common emergency. And what's really fascinating, though kind of scary, is that these accidents spike right when the seasons change. Think about it. The temperature drops, so we drag out the space heaters, we light the fireplace, we burn candles, or the power goes out and we're relying on open flames. Basically, the places we feel safest, our own homes, suddenly turn into high-risk environments. This isn't just about a bumped pan in the kitchen, it's a massive public health challenge. So here is our medical triage roadmap for today. We're going to cover 1. The 5 types of burns, 2. Decoding burn degrees, 3. First aid and the golden window, 4. Specific first aid protocols, 5. Dangerous first aid myths, and 6. Emergencies and prevention. All right, let's jump right into section 1, the 5 types of burns and how to identify the hazard. Medical pros actually group burns into 5 main types, and each one carries its own sneaky hidden dangers. The first, and definitely the most common, is the thermal burn. This is your classic flame, touching a hot stove, or getting scalded by hot water or steam. The big risk here is that your tissues are rapidly cooking. Then you have electrical burns. What is so deceptive about electricity is that it takes the path of least resistance through your body, which usually means traveling right along your nerves and blood vessels. So even if the burn on your skin looks totally minor, the internal tissue or cardiac damage could be catastrophic. Third up are chemical burns from caustic stuff like bleach or battery acid. These are super unique because the injury just keeps going. The chemical will literally continue to destroy the tissue as long as it's sitting on your skin. Fourth is radiation, which usually means severe sunburns from UV rays or sometimes medical treatments. Those actually cause long-term cellular DNA damage. And finally, friction burns. You probably know this as road rash, which happens when skin rubs super hard against a rough surface. The main thing to watch out for here is a really high risk of infection from all the abrasions. Knowing what caused the burn is exactly what tells us how to fix it. Moving right along to section 2, decoding burn degrees, where we assess the damage. To understand this, think of your skin like a 3-layer cake. On the very top, you've got the epidermis. That's your waterproof outer shield. Right underneath that is the dermis. Think of the dermis as the engine room. It's totally packed with collagen, blood vessels, and nerve endings. And at the bottom, there's the subcutaneous tissue, or hypodermis, which is basically your fatty insulating layer. So a first-degree burn, like a standard sunburn, is superficial. It only damages that top layer, the epidermis. It gets red, it hurts, but the skin's barrier is still intact, so your risk of infection is pretty low. But the moment that damage drops down into the engine room, the dermis, we are officially in second-degree territory. And if it blasts right through all of those layers into the fat, that is a third-degree burn. Now, if we zoom in on second-degree burns, there's actually a massive distinction we need to make. Doctors split these into 2 camps. First, you have superficial partial thickness burns. These just hit the upper part of the dermis. You'll see moist, red blisters, and if you press gently on the skin, it will blanch, meaning it turns white for a second. Because those nerve endings are exposed but very much alive, these hurt a lot. But the good news? You can often safely treat these at home. On the flip side, we have deep partial thickness burns. These go way down into the deeper dermis. The wound is going to look mottled, maybe white or yellowish. It feels rough, and crucially, it might not turn white when you press on it. These are high risk. You absolutely cannot treat a deep partial thickness burn at home. They almost always need a doctor and sometimes even surgery. Going even deeper, we hit the most severe categories. A third degree, or full thickness burn, completely wipes out both the epidermis and the entire dermis. The skin ends up looking waxy white, leathery, or even charred black. You might even see clotted blood vessels right through the tissue. Now, here's a really crazy counterintuitive fact. The center of a third-degree burn is often completely painless. Why? Because the heat literally incinerated the nerve endings. They're gone. And finally, a fourth-degree burn. This happens when the injury blasts past the skin entirely and starts destroying deep structures like muscle, tendons, and even bone. These are absolute, life-threatening emergencies that frequently result in permanent disability. Okay, let's get into Section 3, First Aid and the Golden Window. This is all about stopping the burn process in its tracks. When a burn happens, you enter this critical golden window, which is basically the first 20 minutes. Your immediate priority is to stop the physical cooking process. Think about it. Even after you pull your hand away from a hot pan, the deeper layers of your skin are still holding on to that residual heat. Through thermal conduction, that heat just keeps destroying tissue. It's exactly like how a steak keeps cooking even after you take it off the grill and put it on a plate. To stop this, we use a super simple, memorable protocol: cool, cover, call. Step 1. Cool the burn with cool running water for a full 20 minutes. And hey, if you don't have a sink nearby, use whatever clean, cool liquid you have. Seriously, dumping a cold soda on it works in a pinch to stop the burning. Step 2. Get any jewelry or tight clothes off immediately, because swelling is coming and it's coming fast. Step 3. Cover the area loosely with a non-stick dressing or, honestly, just everyday plastic cling film from your kitchen.
So when you're cooling it, you want a nice, steady stream of water. And notice I said cool, not freezing ice water. Keep it under there for about 20 minutes. And taking off rings and watches is absolutely crucial. When a burn swells, tight jewelry acts like a literal tourniquet. It can completely choke off the blood supply to your finger, so take them off immediately. But, and this is a big but, if someone's clothing has melted and actually stuck to the wound, do not pull it off. If you do, you're going to rip the damaged skin right off with it. Finally, loosely wrapping the area protects those incredibly sensitive exposed nerve endings from the air, which cuts down the pain tremendously and keeps out bacteria.
Next up, Section 4, Specific First Aid Protocols. This is where we tailor the response to the hazard.
Cool and cover is brilliant for regular heat burns, but what if you spill a chemical on yourself? If it is a dry chemical powder, whatever you do, do not immediately put water on it. Mixing water with certain chemicals causes a thermic reaction, meaning it heats up and becomes way more corrosive. You have to carefully brush the dry powder off first and then rinse it. If it's a liquid chemical, just flush the area with water for anywhere from 15 to 60 minutes. And if you get it in your eye, always flush from your nose outward so you don't accidentally wash the chemical into your good eye. What if someone gets burned by hot tar or asphalt? Cool it down with water for sure, but never try to peel it off. You have to let it cool, wait for it to get brittle, and then doctors can carefully crack it away. For electrical burns, your #1 priority is the power source. Do not touch the victim until you are 100% sure the power is cut. Remember, electricity causes invisible internal damage, so check their airway and breathing and be totally prepared to start CPR if needed. And here's one step everyone forgets: getting a tetanus shot. Burn tissue creates the perfect oxygen-free environment for tetanus bacteria to throw a party, so always make sure your tetanus booster is up to date within the last 5 to 10 years.
Which brings us to Section 5, Dangerous First Aid Myths. Let's talk about what you should never, ever do.
We've all heard these crazy pantry remedies from our grandparents, right? Well, let's look at the actual science of why they turn minor burns into hospital visits. First off, never put butter or cooking oils on a burn. Oil is an insulator. It literally traps the heat inside the skin and forces the burn to go deeper. Never use ice. Ice causes your blood vessels to clamp down hard, vasoconstriction, cutting off the blood supply to tissue that desperately needs it, and you can easily give yourself frostbite on top of the burn. No thanks. Don't use toothpaste either. The menthol and abrasives will just irritate the wound and trap bacteria inside. And listen, never intentionally pop a blister. I know it's tempting, but a blister is nature's perfect, completely sterile bandage. Popping it destroys that seal and invites tons of bacteria straight into the raw skin underneath. Lastly, skip the cotton balls when cleaning a burn. Those tiny little fibers will glue themselves to the wound, making them incredibly painful to remove and skyrocketing your risk of infection. Just stick to cool water and sterile non-stick gauze.
Finally, Section 6, Emergencies and Prevention. Let's look at how to stay proactive.
So how do you know when a burn goes from a home care situation to a call 911 immediately situation? The medical criteria for a major emergency are actually really strict. You absolutely need a doctor for any third-degree burn, period, no matter how small it is. For second-degree burn, it becomes an emergency if it's larger than about 2 or 3 inches across, or roughly the size of the victim's hand. Also, any burn that hits the face, hands, feet, genitals, or over major joints is an automatic emergency. Scar tissue in those areas can tighten up and permanently restrict your ability to move. We also have to watch out for vulnerable folks. Kids under 4 and adults over 60 have much thinner skin, so their burns go deeper and complicate faster. And please be incredibly vigilant about inhalation injuries. If someone was trapped in a smoky room, listen for a dry cough, look for singed nasal hairs, or watch for breathing trouble. The airway can swell shut internally very, very quickly, and it's absolutely fatal if not treated. Now, even if you do everything right with a minor burn at home, you still need to monitor it. Your skin's whole job is keeping germs out, and a burn leaves the front door wide open. So here is your infection checklist. If you see pus or smell any weird drainage, that's a massive red flag. Watch out for full-body symptoms too, like a sudden fever or chills. If you ever notice streaking redness, like red lines traveling away from the burn, that means the infection has hit your lymphatic system and is moving through your body. You need to go to the hospital right away. And of course, rapidly increasing swelling or a lot of heat radiating from the wound means it's time to see a doctor. For folks who survive severe, full-thickness burns, the recovery journey requires an unbelievable amount of resilience. In the hospital, surgeons often have to perform what's called debridement. That is the surgical removal of dead, damaged tissue to stop deadly infections, like sepsis. And if the area is too badly damaged to heal itself, they'll do skin autografts, which is taking healthy skin from another part of the patient's body and patching it over the burn. But we really need to highlight that the physical healing is only half the battle. Severe burn survivors deal with massive amounts of trauma, anxiety, and PTSD. Treating a patient's mental health and psychological well-being is literally just as crucial as the physical therapy needed to get them moving again. Keeping all of this in mind, I want to share the most mind-blowing statistic of this entire explainer. Experts agree that 90% of all burns are completely preventable. 90%! So let's talk about some quick ways to bulletproof your home. First, the 120-degree rule. Go check your home's water heater today and make sure it is dialed strictly to 120 degrees Fahrenheit. Hot water sitting at just 140 degrees can give you a deep third-degree scald in a matter of seconds. When you're cooking, make it a habit to turn all pot handles inward toward the back of the stove, totally out of reach of little kids or just your own clumsy elbows. Unplug your curling irons and hair straighteners the exact second you finish using them. And obviously, hit the test button on your smoke detectors every month and replace a whole unit every 10 years. Ultimately, burn care is a race against time, and it's a race against heat. Knowing how to properly categorize a burn and applying the right first aid right out of the gate can legitimately prevent a lifetime of permanent scarring. We've covered a ton of ground today, from spotting chemical and thermal hazards, to understanding the layers of our skin, to mastering that 20-minute golden window of cooling and covering. So I want to leave you with a quick challenge. Take a walk around your house right after this. Look at your kitchen and your bathroom. Are they proactively set up to protect you, or are they quietly hiding your next medical emergency? Stay safe out there.
Did you learn something new and exciting about how to apply first aid to burns? Share it here. I want to know about it too.
This video was researched with Perplexity, processed with Notebook LM, refined with Google Workspace, Gemini, and Copilot, and finalized with DaVinci Resolve and Canva.